In this video, I will talk about the fundamentals of psoriasis, its causes, its effects on daily life and the body, as well as its symptoms and the treatment and management that could be used to go against it. This video will also include 3 interviews with people who have psoriasis, as well as 2 specialists who will give their peace of mind on this disease. To understand psoriasis, we first need to understand how normal skin works. The skin is divided into 3 layers: the epidermis, the dermis, and the hypodermis. Psoriasis affects mainly the epidermis, which is the top layer of the skin. The epidermis is mostly made of cells called keratinocytes. These cells normally grow at the bottom of the skin and then reach the surface where they will die and shed naturally. The epidermis is organized into 3 different layers called strata: the stratum basal, stratum spinosum, stratum granulosum, and stratum corneum, which forms the outer protective barrier of the skin. So when someone has psoriasis, doctors can see that visually it is pretty clear, but if they need something else to make sure they're right on the diagnosis, they will obviously use a microscope. And what actually reassures them that this is psoriasis are the changes under a microscope. One of these changes is called acanthosis, which means the epidermis starts growing thicker because the keratinocytes are growing too fast. Another change is parakeratosis, where cells in the stratum corneum keep their nuclei even though they're supposed to lose them. This shows that the cells did not fully mature. Doctors can also see a loss of the granular layer, meaning the stratum granulosum becomes thinner or even disappears, which weakens the skin's normal preparation for its protective barrier. There are also mural microabscesses, which are tiny clusters of immune cells called neutrophils that are trapped in the stratum corneum, showing active inflammation. Sometimes there's also spongiosis, which means small spaces fill with fluid between skin cells, and that can cause swelling. So, what goes wrong with psoriasis? What is the difference between normal skin and psoriatic skin? Well, in healthy skin, keratinocytes take up to 28 to 30 days to go from the bottom to the surface of the epidermis to shed invisibly. But when you have psoriasis, this process becomes extremely fast. Skin cells reach the surface in only 3 to 5 days. Because they move quickly, they don't mature properly and begin to pile up. This is what creates the thick, scaly plaques in psoriatic skin. These plaques often appear red, inflamed, and covered with silvery white scales. Psoriasis is not caused by poor hygiene or lifestyle choices or even something contagious. It is caused by a combination of genetics, immune system behavior, and environmental triggers. First of all, there's a genetic component. Having these genes does not necessarily mean you will get psoriasis. It just means that the person's body will have the potential to develop it in the future. Second of all, the immune system plays a huge role in this. When you have psoriasis, the immune system sends too many inflammatory signals to the skin, which becomes overreactive, and the skin cells will grow much faster than they normally should, and that will create chronic inflammation. Finally, there are environmental and lifestyle triggers, and yes, I mean triggers. So these do not cause psoriasis by themselves. They can activate it or worsen it to someone that is already genetically predisposed. Common triggers include infections, skin injuries, stress, smoking, alcohol, or a poor diet. So a helpful way to think about this is that the genetics load the gun and the environmental triggers pull the trigger. So overall, psoriasis is caused by a genetic susceptibility combined with immune dysregulation, and the environmental factors actually determine how strongly this disease will appear. So how do you distinguish psoriasis from any other skin conditions like eczema?
Psoriasis usually causes thicker, well-defined patches with silvery scales, while eczema tends to be more itchy and less sharply defined and appear in the skin fold.
So when do you decide to refer a patient with psoriasis to a dermatologist?
Whenever psoriasis is severe, widespread, and not responding to initial treatment.
So first, let's talk about the skin. Because skin cells grow much faster than normal, this creates red, thick plaques. The skin becomes dry, cracked, itchy, and can sometimes bleed if it's scratched too much. These plaques can burn, sting, or even be painful, especially during flare-ups. Psoriasis can also cause joint pain. About 20 to 30% of people who have psoriasis develop psoriatic arthritis, which can cause joint pain, swelling, stiffness, or even all the fingers can be swelled up in the morning. Of course, if it's not treated, this could lead to permanent damage. But psoriasis doesn't stop there. Because it's an inflammatory disease, the inflammation can spread through the bloodstream and attack other systems inside the body. People with psoriasis have a higher chance to have type 2 diabetes or even some heart problems. This is why psoriasis is now considered as a system-wide inflammatory condition and not just a skin problem. Now, let's move on to the psychological impact. Many people experience anxiety, depression, low self-esteem, especially because this condition is visible and often misunderstood. Itching and pain can also disturb sleep, which could lead to lack of concentration and a lack of energy. Because teenagers and children are very affected by this condition, negative reactions from other people, such as laughing or asking if it's contagious, can deeply affect their self-image and their confidence at such a young age. And finally, psoriasis affects everyday life in very practical ways. Pain on the hands or feet can sometimes make it difficult writing or make it difficult walking. Scalp flakes can also be embarrassing, and because of that, a lot of people avoid doing sports or avoid wearing certain clothing just for them to not be seen. All of this shows how psoriasis is not just a medical condition, but a physical, emotional, and social challenge that shapes people's day-to-day life. The most common is plaque psoriasis, which causes thick red patches covered with silvery scale that is usually on the elbows, knees, lower back, or mostly on the scalp. Next, we have gutted psoriasis. This mostly affects children and teenagers. Next, we have inverse psoriasis. This appears in skin folds like the armpit or the groin, and it usually appears smooth, red patches without much scaling. Psoriasis can also affect the nails, causing pitting, thickening, or even discoloration. Less common forms include pustular psoriasis, which causes by pus-filled bumps. There's also erythrodermic psoriasis, which is a rare and severe type covering most of the body. None of these types are currently curable, but this brings me to my next point: it could be treated. There are many treatments that help control symptoms and help reduce inflammation. So what would you say are the main types of treatments used for psoriasis, and how do they work actually?
In the pharmacy, we usually see two main types of treatments. The first ones being topical treatments, so that's either creams and ointments like Dovobet gel, for example. And the other types of treatment we see are biologics or systemic treatments. And those are usually in a form of an injection, and those work from inside the body to help calm inflammation. For more severe cases, that's usually what we'll use. And then there are other types of treatments that exist, like phototherapy. That's not something we see in the pharmacy usually.
Something not a lot of people think about is that managing psoriasis comes back to managing your daily habits, such as moisturizing regularly, avoiding triggers, managing stress, having a healthy diet, and following the treatment plan consistently. So in short, psoriasis is caused by an overreactive immune system and rapid skin cell turnover, which can lead to chronic inflammation. In the next part of the video, patients will confirm my explanations through their experience and clinical knowledge. Can you describe what it's like living with psoriasis on a daily basis?
Honestly, it's not that bad. It's just very unpredictable. So like you could go a whole month without necessarily having psoriasis, but like you could wake up one day and it's like really bad flare-ups, and it's just really annoying.
So how would you think psoriasis affected your confidence or the way you see yourself?
It's definitely affected my confidence, because you feel because you know it's there, so you feel people are watching it, and you can also feel it on your skin, right? And once I had a really bad flare-up all over my face, and you still have to go to school, so it was kind of really embarrassing. But yeah, it's...
Question: what advice would you give to someone that was newly diagnosed?
Well, I would first tell them that it is okay, even though it's not something normal that they thought. Now they're gonna think they live with it forever. It's fine. With time, you get used to it. It doesn't become what you were afraid of. Also, if people think at first that, oh, it's a contagious disease, you should inform them by providing them with information. I think that helps a lot, because then they're going to inform other people. They're going to talk about it with other people, which is how people learn. And follow your doctor's treatment plan. Honestly, like, it's meant for you, it's meant for your skin, it's meant to make you better.
And yes, I have experienced psoriasis as well. It is actually what kind of motivated me to make this video. I had psoriasis since I was 10 years old. At that time, I had no idea what it was. When I was in primary, a lot of kids would ask me what it was, and they wouldn't ask the nicest way, and I didn't have the right explanations. Of course, my doctor explained to me that I was a chronic autoimmune disease, but I didn't know what those words meant back then, so if I told them to the kids, they wouldn't understand either. Something else I really learned is that once you see improvement, it doesn't mean you have to stop the treatment. In order for treatment to actually work, you have to keep using it even when you see signs that it's improving, and that I had to learn it the hard way. Something I really don't like about psoriasis is that it leaves and it comes back. So for me, for about a year, I didn't have any sign of psoriasis, but then it reappeared during winter because weather has a big impact on psoriasis as well. I made this video on psoriasis with the purpose of informing those who may not know what it is and to encourage people before they make assumptions like, oh, it's contagious. Because educations matter, because words have a real impact. Thank you for watching. If you found this video helpful and learned something new, please like and subscribe, and I'll see you next time.